Hey, so my name is Saritz Rosario, and this is my Nursing 335 clinical reflection video. The purpose of this video is to explain how I met the 8 objectives for Nursing 335. So objective number 1 is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. So I believe this was done through my peer leadership experiences in Nursing 309 and Nursing 321. So with Nursing 309 students, I assisted them with writing their medication cards, as well as how to properly access medication from the Pyxis located in the lab, because this was a new skill that they would learn that day. I also work with Nursing 321 students, working on their head-to-toe assessments within the Lehigh Valley Hospital. These experiences allowed me to apply my previous knowledge from clinical and classes to assist my classmates in perfecting their nursing skills and pinpointing essential information to write on their medication cards. Also, I believe I achieved this objective through my service leadership experiences. So I attended Luther Crest, which is a senior living community. While I was there, I followed a variety of workers, and I went into units such as the assisted living facility and the memory care unit. Specifically, while I was on the memory care unit, I used knowledge gained through my health promotion classes such as Nursing 309 and Nursing 321 about patients suffering from Alzheimer's and dementia. A specific time that I can recall was when I was transporting a patient to their room after they had attended a ceremony. So she was very confused about her surroundings and where she was. So I reoriented her to her location and used things such as pictures located in her bedroom to assist with me in reorienting her. So objective number 2. So this is to apply the basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. I believe this objective was achieved when I followed a nurse practitioner named Brian Weinberg, who specializes in the bariatric population at Lehigh Valley Cedar Crest. While working with Brian Weinberg, he displayed the ethical principle of beneficence. As stated by Sullivan 2018, beneficence means compassion, taking a positive action to help others, and is a core principle of patient advocacy. So through Brian, he is a nurse practitioner, and he would recommend his bariatric patients who are going through elective surgeries such as a gastric bypass to get a psych evaluation due to the amount of weight loss causing not only physical stress, but also being mentally draining. Also, when I went to my nursing supervisor experience and I followed Heather and Susan, I noted the management side of the healthcare environment. So they rotated among units, ensuring adequate staffing, effectiveness of care by acknowledging both the nurse and the patient concerns, and they would work towards a solution when a problem was presented. Objective number 3. So this is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So I believe I achieved this objective through emailing, sending thank you letters to the professors as well as the other professionals I followed, and attending my experiences wearing professional attire. So my emails, so these contain information about myself, the reason for contacting the professional, as well as an availability schedule for the month, to set up a common time to shadow them. My thank you cards were personalized and handwritten, and acknowledge moments in my experience where I gained knowledge from the different professionals. All of this data was saved and printed, and I placed it into my leadership binder for reviewing at the end of the semester. Objective number 4. So this is to critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So for this objective, I was specifically looking for an article on abortions, but I actually came across a topic that was new to me. And this is abortions related to fetuses who have disabilities. So the article I found is called Ethical and Legal Issues Regarding Selective Abortion of Fetuses with Down Syndrome. And this article is by Noreen Glover, and I also will be sharing this in post-conference. So this article begins by giving a brief description of Down syndrome, as well as the statistics and the definition of a legal abortion. Glover also gives background on the two sides of abortion, so those who are opposed and those who are advocating for abortion. So Glover stated that in a pregnancy that involves a fetuses with Down syndrome, A woman may attain a therapeutic abortion or a medically necessary abortion after viability, which is the 12th week. So not all states perform this type of abortion, but according to Glover, states such as Colorado, Delaware, Texas, Idaho, Kansas, Maryland, New Hampshire, New Mexico, Utah, and Pennsylvania have this law. So some ethical principles that she discussed within the article included beneficence, non-malfeasance, and justice. So as stated by Sullivan again, beneficence is compassion, taking a positive action to help others, and is a core principle of patient advocacy. So when discussing this principle, Glover addressed both sides, so the fetus as well as the parents, and she brought up the idea of quality of life for both the individual with the disability and the caregiver who is taking care of the person with the disability. When discussing non-malfeasance, Glover addressed the concern of late termination, causing pain and suffering to the fetus whose brain and nervous system has fully developed. And when discussing justice and equality, Glover addressed how treatment of a fetus with a disability should be the same as that of a fetus without disabilities in order to comply with this principle. Okay. So objective number 5. So this is to function as a competent patient advocate, nurse advocate, and change agent. So I believe that this objective was accomplished when I attended Capitol Hill Day and also assisted the community by doing Meals on Wheels. So at Capitol Hill Day, we listened to the PSNA lobbyist explain reasons why nurse advocacy for the nursing profession is imperative. So he gave us information about the lack of nurses within the legislative committee affecting the change among the nursing profession. And he also stated that there's only 3 within the legislative committee. And then on Meals on Wheels, I noticed patient advocacy. So this program, it provides the elderly population with proper nutrition, ensures safety of the individual, and provides them with daily communication. So proper nutrition. So this is done by providing them 2 meals for the day. So a hot meal as well as a cold meal. And this can be personalized to what they'd like. And also it can be a diabetic diet as well as a regular diet. Ensuring safety. So usually in the elderly population, they lack for people to see them. So with this type of volunteer work, you must see the individual, even if that's entering through the door, going up to their bedroom, but you must be able to see the individual, or else you would have to call the number given to make sure that they are contacted, family is contacted to see what's going on. And providing daily communication. So as we know, the elderly population, they're usually in a living facility or they lack family members. So providing daily communication. So these volunteers, they can go into their home, they can speak with them, they can have an interaction, they can cut up their meals if need be. So it's a nice way for the volunteers and the elderly people to have some social interaction during the day. And also during my experience, I noted that most of the clients, they really appreciated the work of the volunteers, and they made it very known through hugs and handshakes, and also a big smile when answering the door, and a nice big thank you at the end. So objective number 6. So this is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So this objective was achieved when I attended 4 SNA Dine and Discusses throughout the semester. So two topics that really stood out to me between all 4 was when a presenter came and discussed substance abuse amongst nurses, specifically nurse anesthesiologists. They explained ways on how to detect an impaired nurse colleague, what are the processes to reporting an impaired nurse colleague, and also how to help emotionally this nurse colleague, because you also want to find out why this is occurring, what's going on in their life that's causing them to be this way, and you also want to make sure that this is reported because of the effects on patient care. And then also, there was a presentation from Good Shepherd. So this is a hospital in Allentown, Bethlehem, and other areas. And they came and provided us with opportunities, and they told us the specialties among their hospitals, such as rehab, pediatrics, and others. So objective number 7. So this is to recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. So I believe this also was accomplished through Capitol Hill Day. So I spoke with the assistance of Judith Schwank, which is the Berks County legislator, about new bills within the committee. And some of these that I tried to discuss were nurse practitioner bills, safe patient-to-nurse ratios, as well as improving access to mental health care. So specifically, one that the assistant was very familiar with was the nurse-to-patient bill that was introduced by Dylan Leach. So she gave me insight on her perspective of the bill, and I also described reasons why I believe that this bill should be passed. So I gave 3 reasons. So decrease infection risk among patients, improvement in quality of care so that nurse and patient interaction is improved because nurses have time to actually be with the patient, as well as the low turnover rates among nurses due to the decrease in work-related stress levels. Okay. And objective number 8. So this is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So provision 6 of the ANA Code of Ethics states, the nurse through collective or individual or collective effort establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. So during my nursing supervisor experience, there was an incident that occurred on one of the units. So there was a patient who was actually recording the nurses on Facebook Live while they were performing their care. So the nursing supervisor was notified, and she came and we talked to the patient. Well, she talked to the patient about the repercussions that can be about because of her actions. So she stated that this can be punishable by law and that nurses have the ability to sue her if they see themselves on Facebook without their consent. In the end, the patient cooperated and the nurses stated feeling more comfortable now when they entered the room and were providing care to the patient. And this prevented a huge ethical dilemma within the clinical setting. So thank you so much for taking the time to view my video and learn about my goals throughout the semester in Nursing 335.